Partial data on the spread of COVID-19 in Boston points to what many view as new evidence of racial and social divides. That especially goes for Blacks and African Americans, who account for more than 40% of the people with confirmed infections, but only 25% of the city's population. The infection rate's also higher along parts of the Fairmount Indigo corridor, including parts of Dorchester and Mattapian, represented by our guest, Boston's District 4 City Councilor Andrea Campbell. Thanks very much for being with us, Councilor.
Thank you, Chris, for having me.
Councilor, I want to start with things that you're hearing from the district and just seeing around you in the neighborhood. What's it like right now?
In some pockets, it's a ghost town, right? So it's folks making sure that they're physically distancing and staying in and sort of waving from their yards to each other from afar. There's others who are suffering in that they are positive cases of COVID-19 and have been hospitalized and quarantined and are recovering. Some have passed away or know a loved one who's passed away and have been unable to attend a funeral, which is, of course, very difficult and challenging. We have many folks who are on the front lines as MBTA workers, city employees, fire, police, EMS employees for the city. Your trash, it gets picked up. Those are folks who live in my district who work for Public Works. The list is long in terms of the number of employees we have on the front lines every day. And then we have a lot of small businesses. Some are doing okay. They're creative in that they're looking for new ways to ensure that they can continue to bring in revenue. I was just talking to a business owner that runs a health shop and offers smoothies and various things. So now they continue to make those, but you can go in, grab it, and leave. Others are getting creative and take out menus, and residents are stepping up to support those businesses as best they can. So that's a topic of discussion. And then, of course, everyone is talking about the inequities. But from the vantage point of District 4 residents, we've been living with these inequities for a really long time. This isn't new. The COVID-19 crisis and pandemic is just raising these inequities to the surface in a horrible way, in that people are dying. And the hope is that we will come together as a community to meet immediate need, and then long term, we will eradicate these inequities for communities of color.
What do you think about the figures so far? More than 40% for the city of Boston, Black or African American, and those are incomplete figures, so those could even get higher when we're all coming.
And I anticipate that they will get higher. This trend that COVID-19 is disproportionately having an impact on the Latino community as well as the Black community, and more pronounced in the Black community. We're seeing these numbers reflect what's happening nationally. In Chicago, Detroit, some horrific stories coming out of these cities. And in Boston, it's no different. And I think when we get complete data on not just the diagnosed cases, but also the deaths, we will see that the Black community will suffer tremendously from this pandemic.
Well, the usual thing that people conjecture about right now is, well, there are other things going on. There's overlaps with disparities in areas such as hypertension or diabetes, but do you see more than that maybe?
So on the one hand, our folks are the wage workers, the frontline workers, so they are at risk by the nature of their jobs, so they're exposed. But they also are folks, including other members of our community, who do have these underlying conditions. And there are higher rates of asthma, diabetes, autoimmune conditions, and other underlying factors that contribute to higher cases. But I remind folks that these health disparities that have been with us for some time are as a result of systematic racism in race and institutional racism. It is uncomfortable for many to talk about race and racism, but in this country, we have to. And if we do not talk about these issues in an honest way now, we will never complete the picture or really get a sense of what's happening and why it's affecting certain communities. These health disparities didn't happen overnight. When we use race and have used race in the past, including right here in Boston, to exclude, to marginalize people, to take away economic opportunity, to say you can't live in a certain neighborhood because you are Black, you can't have a certain job because you're Black, you can't go to a certain school this happened in this city, and this happened in this country. And as a result of that, these communities suffered some tremendous devastation, both in their health, in their economic reality, in the social connectivity of communities, in criminal justice and incarceration rates. All of that is an effect of race and racism, and we have to talk about it now. And the silver lining, I think, one is that, hey, people are dying, and if you want to be a part of the solutions and saving lives, then come to the table, have the uncomfortable conversation, listen to these folks in the community who have solutions on how to get out of this pandemic, and be a part of the solution. And that's the conversations I look to broker with folks from across the city of Boston.
I want you to maybe explain a little bit more about the occupational exposure, because there are some people who can work from home and make good money. There are other people who have to work hard and do it somewhere else.
That's right. I mean, I was just talking to a constituent who works for the T, who now has to get tested because her colleague's spouse came back positive, and the colleague is getting tested and may come back positive. And she cannot work from home. She has to go into work. But more importantly, our folks not only have to go, many, it's required they go. Otherwise, they will have no income to take care of their families. And right now, some of our people are receiving unemployment benefits, but we know that it's taking a long time. Navigating that system can be very difficult. I'm lucky that I do have some folks in the state delegation who are working really hard to make sure the cases are resolved quickly and that people get resources in the immediate for their family. But it's twofold. It's our folks are showing up to work to serve their city, and also some folks who have to because they need the income and they don't have a salary or benefits if they don't show up.
One thing being pushed to the surface right now is who gets critical care, especially if there's any scarcity. We have guidelines for that issued by the state. They're supposed to prevent bias, but what do you see in these?
So I'm actually introducing this in a council hearing with Councilor Ricardo Arroyo, and he represents District 5, Mattapan, High Park. We split Mattapan. So we're seeing these inequities show up in the community. And when we learned about these guidelines, I think we both were frustrated that, one, most people don't know about these guidelines. So the question is, who was engaged, who was at the table, and who informed these guidelines? The community should have been a part of some of those conversations, or at least it should have happened in a more public way. How are the hospitals going to respond to these guidelines, which the Governor Baker's administration is saying they're guidelines, they're not mandated? Well, each hospital has to listen and respond. So what are their individual plans if we get to a point where we are rationing ICU beds and ventilators? I want to know that my people that have underlying conditions and higher rates of health disparities, of diabetes and asthma and other health issues, that those inequities will not limit or prohibit them from actually getting a ventilator and ICU bed. We have to be very intentional about serving these communities. We have to talk about, again, race in these inequities, in these conversations. I know many are saying, well, race isn't included in the guidelines. And I think, well, that's a mistake. We can't be colorblind here. Race was used to marginalize and exclude people. So in the healing, in the solutions, in the recovery, we still have to talk about the presence of race. And so this conversation with Councilor Arroyo will hopefully do just that. And we don't want those who are suffering the most to die. And I'll be very frank, to die.
I want to ask you about mental health, because a lot of people, some people just fed up with staying inside all the time, but some other people, they're out of work, they're out of money. So what's going on for them?
That's right. And Phil, I was lucky to partner with Councilor Anissa Sabi-George, who's been doing a lot of work in this space, and Councilor Julia Mejia on a hearing order recently, or actually a resolution to request that the city of Boston come up with a mental health support fund, which is similar to some other places around the country, to allow organizations that are serving the mental health effects of this with for our residents to have access to resources to expand the capacity to serve the trauma that is currently inflicted on certain communities, and frankly, the mental health for everyone. We're looking at the stats on TV, and I'm telling folks, turn it off every once in a while, take some deep breaths, self-care is critical. It's going to have an effect in the short term. It's going to have an effect in the long term. So we have to look at these issues also through a mental health lens. And so that conversation is very important, and I will continue that with my colleagues and the administration.
You've also been raising questions about how things are going with education out of school. I imagine there are going to be some disparities here as well. Do you see those right now?
Absolutely. I mean, the disparities we saw in Boston Public Schools didn't go away, right? If anything, many of these disparities may be exacerbated as a result of COVID-19. And so in BPS, there is a technology divide that always has been. We know that certain communities, Roxbury, Dorchester, Mission Hill, other neighborhoods, have a limited number or a smaller amount of people who are connected to the internet, who do not have the hardware, computers. So kudos to the administration for making sure our young people have access to Chromebooks. But it's one thing to have the hardware. What we also have to ensure is that they know how to use it, and that the quality of instruction that they get is high. It's good quality instruction. And that's a big piece. Right now, there's no consistent standard in the city of Boston across the district. So you have some families where the experience is going well, and others who are not connected, who are disconnected, who do not feel like they're getting enough for their child. And so the resolution I'm introducing today with Councilor Janey is about getting some of this data to ensure that we can respond appropriately and have targeted intervention for families who are disconnected, who are not receiving a good online remote learning experience, and so that we can actually do better with respect to those who are being left out, because we don't want folks and our students to fall behind.
Just before the schools were closed, there was an agreement on a rather large-scale intervention to turn around a lot of underperforming schools in Boston. State was going to weigh heavily maybe, but there was also going to be more funding for this. But given the outlook for the state budget right now, what do you see looking down the line a year or two?
So right now, in the immediate, I am focusing on that all of our families have access to computers and Wi-Fi so that they can participate in some remote learning opportunity. And we, of course, want that remote learning experience to be high quality and excellent. That is the focus right now. Of course, at some point, we need to revisit the conversation around the MOU, the state, the 200-page report that was released that documented some real serious issues with respect to the achievement gap. I'll add an opportunity gap, English language learners, special needs students. We need to dig into that. I was disappointed that it was released on a Friday news dump day in the midst of COVID-19. It is a serious report that needs parents and families and stakeholders at the table, reviewing that and coming up with solutions to make sure that we eradicate these inequities going forward for our students and our families, and so that BPS is excellent for all of our students. And so I look forward to picking up that conversation, but right now focusing on that remote learning experience.